Welcome to the Stronger After Stroke podcast. I'm the stroke nurse navigator here at Norton Healthcare. My name is Rosa Hart, and my guest today is Dr. Tatjana Rundeck. Thank you so much for being with us today.
Oh, thank you for inviting me. That's such a pleasure to be here with you today.
So you are the professor of neurology and public health sciences at the Miller School of Medicine in the University of Miami.
Yes, that's correct. And I hold many, many hats, and fortunately and unfortunately, because there's a lot of work there, but I love it, and that's most important. And one more thing I would emphasize, I also direct the McKnight Brain Research Institute, which is really institute that deals with brain health and age-related memory loss and vascular cognitive impairment.
Cognition and memory is such a huge issue that so many people are dealing with across the spectrum, whether they've had a stroke or not. So I'm really glad that that's something you're able to lend your expertise to in the conversation.
Yeah, absolutely. That is our goal, really, to understand it first and then really reduce it as much as possible. And we want everybody to age gracefully and healthy.
Exactly.
So we actually even have a campaign that we called Age Like a Pro.
Oh, I like that.
So that we can kind of explain what the aging process is and how to age the best to your capacity.
Because there is some decline, I guess, that you would expect as a normal part of aging, but there's a lot that's preventable as well through what we're going to talk about today, which are our modifiable risk factors. So Dr. Rundeck has joined us today because she is our keynote speaker at the Norton Neuroscience Symposium and Expo this year for 2023. And so we've been able to do this interview in addition as a special treat for our stroke survivors and their families. And today we want to talk about brain health and how you can maximize your brain health and prevent stroke through modifiable risk factors. So what would you say is like the number one risk factor for stroke that's preventable?
Right. So the number one risk for stroke, and as you know, and I believe our patients and family know, it's hypertension. So elevated blood pressure is still, after many, many years of research and education and knowledge that we created, are still the most important preventable risk factors. I cannot stress enough how important it is to measure it and to control it. And so, I was thinking about it a lot. And we as physicians and healthcare professionals, we were very focused on medication all these years. And in research, we tried to explain it from biology, right? Whether this is our individual biology with some genes, there are some genetic markers, there are epigenetic, environmental, but we never really took a very comprehensive look at hypertension. Right? So if you go to your doctor, the first it's going to be, you have to change your diet, you have to change your, behaviorals, you have to stop smoking, and you have to take your blood pressure medications, right? We forget how hard it is to change behavior.
It is.
Right? And so I have experience firsthand. My father had a stroke.
Really?
And he lived after that stroke for 10 years. But I can tell you, regardless of all these medications, he could not stop smoking or didn't want to. And it was very hard to change his diet. And and this is all sort of connected and part of the increased blood pressure.
Definitely.
And so there are so many things that you can do even without medication, right? Just take, for instance, salt. Salt is so, integral part of our diet. Whatever we eat, we put salt in it because it tastes better. Everything is, better preserved with salt. So if you eat a lot of products that are off shelf, the foods and meats that are full
they're
full of salt.
processed with salt already. You don't even have to add salt.
No,
You can't
exactly.
even take it out.
Exactly. And so every average American person actually is way above the intake of salt that is recommended daily. So that is about 1,500 milligrams per day, and we are all double. Double. And salt is critical for starting our increased blood pressure. So if we just reduced our salt intake in half of the foods that we take, we can probably prevent half of the hypertension. This is really something that we don't pay enough attention. It's the diet, physical exercise.
Exactly.
Reducing
We're more
weight.
sedentary now than we ever have before. Especially like even those who get to work from home, they may not be stuck in traffic as much as when they were driving in before the pandemic, but we still sit at our desks in front of computers a whole lot more than we did before. And if we're not working in front of the TV, maybe. So
that is also a big part, and they all American Heart Association, American Stroke Association, they all recommend moving. Meaning,
definitely.
even if you sit an hour, you need to wait, sort of stand up and move a little bit and then go back. So the worst thing is this long, prolonged sitting at the desk or in front of TV or whatever you do. Moving, it's critical for not just hypertension, but in general for the whole body, for the brain, for the kidneys. So going back to hypertension, as a physician, for us, the easiest is to prescribe medication. Right? Because we will just say, and there are, of course, especially after stroke, the patients do need medications. And they need, sometimes they need one or two, even more. So, but when it comes to the point that a patient needs to have more than 3 or 4 blood pressure medication, I think we need to kind of take a pause and look really carefully, why is that happening? Right? Is that really what we consider sort of unresponsive hypertension, or something else is going on? There may be some other causes that we need to go into, or people sometimes they don't take medication, they forget.
Definitely, yeah.
They forget, or they live alone. They don't have anybody to ask, well, did you take your blood pressure medications today?
Definitely. I like a lot of the conversations I've had with stroke survivors when they are having their medications just given to them at the hospital and trying to decide, am I going to take it in the morning or at night? And how am I going to remember? And I think one of the main things is we set alarms and have the alarms tell you it's time to take your medication, so that when the alarm goes off, you're not like, what is this alarm for? I don't even remember. So that's a handy thing that we can use our phones for now, is to set those alarms.
I think that's a fantastic idea. I think the more we can use technologies now, that would be really better. And people are now developing all kinds of AI systems that they can sort of prompt people to take medications on the certain times, and even you can use now the phone to even measure your blood pressure or measure your heart rhythm, and that can go directly to some database.
Speaking of which, those fitness watches will remind you it's time to move if you've been sedentary and being still for too long. So this can be really helpful if that's something you will want to listen to and you're not like, don't tell me when not to move.
Absolutely.
But,
that is really terrific. And I know there are many other factors that can cause stroke and cognitive problems, but hypertension and blood pressure is really critical.
And we talked about salt intake,
Mhm.
but sugar and diabetes is another huge culprit. I believe the statistic is that if you are diabetic and you have uncontrolled blood sugar, you're twice as likely to have a stroke as someone who doesn't.
Absolutely.
Is that consistent with your research?
This is consistent with our research, with many other, studies that are run nationally. So this is absolutely important. When I was in New York before being in Miami, I was investigator at the Northern Manhattan Stroke Study that later on became Northern Manhattan Study. So we followed the stroke patients initially, but then we enrolled the healthy people and followed them over 20 years for incident stroke, a new occurrence of stroke, and now cognitive decline and dementia. And what we saw is that having hypertension and exactly what you said, diabetes and uncontrolled sugar actually highly increases the risk of stroke and also cognitive decline and dementia, and what we call attributable risk. So the risk can be 2 or 3 times greater, but when you even account the prevalence or how often is that, how common is it then in population, that attributable risk is incredibly high. So it comes to even over 50-60% of all strokes can be explained by
Wow.
sugar and by cholesterol. And then if you add hypertension to it, it's about 80% of all the strokes can be explained just by those 3 factors.
Which means they're preventable as well.
Exactly.
Now,
And
there are genetic predispositions
yes.
towards being diabetic or towards having hypertension. I believe African Americans are more likely to have it genetically, not even just based on diet, which is when those medications would come in so handy, because if you're dealing with something that your genetics are causing, then those medications are there to help you. But if you are dealing with these because of lifestyle changes that can reduce your need for medications, then that's a really great option.
It's a fantastic option, and we do believe that 80-90% of strokes can be prevented just by taking care of those 3 basic risk factors.
Now, our social determinants of health, though, have come into play for all of these with the physical inactivity. A lot of people need walkable green space near their home, that they are not dependent on having to drive to somewhere if they can't afford to drive there or take public transportation to get to a walkable space. That's a very key factor, as well as food deserts. And food deserts are just as much in rural America. We see that a lot in Kentucky. People live next to a big farm, but their grocery store is the gas station that only has processed food items available to them. So while we do know that having fresh food and having exercise can easily and simply prevent stroke and all these cardiovascular factors, we do have these systemic social determinants of health that we as leaders in healthcare can advocate for in our communities as well.
That's really huge now. And in Florida, we have what we call the Florida Stroke Registry, where one of the big objective is really understand social determinants of health. And so we took approach of looking at quite comprehensively. As you said, one is those systemic built and natural environments, which are huge, and those are walkability, access to the parks, green spaces, which in Louisville Hill here looks pretty nice to me.
Yes,
There's
we have
a lot of green spaces.
Yes, we are building as much as we can.
Right, as compared to, for instance, Miami, where I am, there is, except a few palm trees, it is a lot of concrete, and there is heat, and the walkability is very, very low. considering the heat and the built environment down there.
Mhm.
So, but then natural environment is very important. And then, as you said, there are other sort of structural importance of, access to healthy foods.
Mhm.
Groceries. We know that we all sort of go to the big chains, and
Mhm.
sometimes, it's very hard to buy the food that's in season, fruits and
Right.
vegetables. So you always buy sort of products that are either processed or half prepared, ready, or fully ready. So access to food is critical, but then access to other resources, right? Access to the rehab resources,
Mhm.
access to, physicians, or different, type of professionals that you may need, and other resources that you need, especially if you already experienced some symptoms or you had a stroke, right?
Exactly.
And then there are a lot of social determinants of health on the individual level, and that it's really sort of social economics. And, as you mentioned already, there is geographic, rural versus urban areas, and then geographic across United States. But there are also individual level, which I think we really need to be very strong advocates for our families and our patients, and because education is one of the critical component.
Mhm.
And study after study after study shows that health literacy is low, and we
Yeah.
really need to do better job, and we need to do it continuously, because
Mhm.
I remember when we had the first TPA, the treatment for stroke. So we had a huge campaign, calling 911, understanding the signs and symptoms of stroke.
Because before Alteplase was FDA approved for stroke in 1996, there really wasn't anything you could do. If
The-
someone was having a stroke and you get to the hospital, and then what?
exactly.
What did you do?
Exactly. So now, of course, we have a lot of options for treatment, and
Mhm.
stroke becomes a very exciting field for young physicians, young professionals to go to, because we have a lot of options and for our patients. But still, time is brain, what we used to
Yes.
say. So it's still very important that we understand the risk factors, but also the signs and symptoms to recognize and then call 911. And this campaign, it's been successful to a certain point, but then we stopped. Right. And I think it's time to go again,
Mhm.
because we have newer and newer generation coming in, and unfortunately our health education may not be as great as we would hope for.
Well, and younger people are having strokes too, and
Yeah.
they may be more likely to think they're not having a stroke. Maybe they think they're having a migraine, or in some cases, blood sugar shifts can mimic stroke symptoms.
Absolutely.
So, getting evaluated to see, is this really a stroke or is this something else, is important. I think it would be important to talk about those other modifiable risk factors that involve that social
Mm-hmm.
interaction, because on the one hand, I believe we talked about infrequent social contact
Mm,
and isolation
yeah,
is an independent risk factor, isn't it, for stroke?
absolutely. And we and others came up with some good sort of data to show that social isolation, it's a huge risk factor for stroke and for cognitive impairment. So um, way back, we even looked at number of friends that people have, and it turned out, if you don't have a contact with more than 2 or 3 people on a regular basis, daily or weekly, that creates a social isolation and also predisposed to risk of stroke.
And is that due to like mental health, like depression, or what do you think that connection is?
So there are multiple factors. One is definitely something as a personal psychological, mental health or personality type, right? There are
Mm-hmm.
some people that are more introverts, some that are more extroverts. So, but there is also certain things that, especially after stroke, you feel really depressed, and it's really partially for biology of stroke, but also is reasonable to be depressed that such a huge event happened, and after that you feel that you're not yourself as you used to be. You cannot possibly move as well. You don't have feelings, the same feelings. You have trouble talking, thinking, reasoning. And so you kind of feel you don't want to show this, right? So you kind of get
Hide.
and hide and become more and more isolated and so depressed. And so the newest data that we're about to publish, it's interesting.
Oh, we get a preview into some unpublished data? Okay,
Yeah.
what is this?
Actually is that post-stroke, the living with children actually improves recovery post-stroke.
Oh.
It
So
is
like those
really,
multi-generational homes where they have the
yes,
grandparents in the
absolutely. And
home.
we tried to dig in a little bit, and it's really helps um, uh, being less depressed, but even more, it's motivation.
Mm-hmm.
Because a father or grandfather comes home post stroke and feels depressed and feels my life is over, I'm never going to be the same, and I just don't want to do anything. I don't want to exercise, I don't want to go out, I don't want to feel, and I don't want to see other people. And as much as it's important to have a good spouse and caregivers, but this sort of generational gap gives a little bit different perspective to a children or grandchildren, because then they would be more sort of motivating.
Do you feel like it is important because it gives hope for the future in a way?
It's not just that, but it's like, you know, one example, the grandfather would sit in the chair and say to grandchild, well, bring me that, cup of coffee, or bring me that, tea from there. And the kid would be, well, why don't you get it by yourself? Well, you can walk. Well, take your walker, go and get yourself.
Children can be so honest.
Yes, and it was like, and it never occurred to me. And actually, that is sort of a forced motivation that actually some people do need.
Mm-hmm. Definitely that social accountability
It's incredible.
from the people who care about them.
Yeah, and if you construct this in a even mathematical model, right? How we do all this modeling, how we get to those results, and what you mentioned, the risk factor, the risk ratios, or the likelihood, right? Mm-hmm. So when we put that in mathematical modeling, and we put, blood pressure and other risk factors, and then this factor living alone or living with spouse or living with the children, and then this children variable, if you will, comes up so strong with the high sort of effect size, what we call in the mathematical modeling, that I think it's really, really interesting. So and others have shown something similar. Similar with that, and also living sometimes with or in the community with peers helps too. Mm-hmm. So there is some value of these communities when we call them 55 plus, mm-hmm. or
retirement communities.
Retirement communities, because the peers also help each other. Good. And support each other. So I think you're completely, absolutely right. So I think that social determinants of health, whether the individual level, psychosocial, economic, which is again huge, geographic, built and natural, environments, are going to be huge. To actually think the best way how we can improve them, because they're going to help risk factors, as well as sort of after the events, better recovery, faster recovery, and better outcomes for the stroke patients or even cognitive patients.
Well, let me ask you something related. It may not be as precise as your data, but I've heard that you are the average of the 5 people you spend the most time with. In general, meaning you eat similar, you have similar social habits like alcohol intake, smoking, activity level, what you enjoy doing together. So, as someone's listening to this who is a stroke survivor or their family member who's taking care of them, how important is it for their support network to also quit smoking or to engage in activities to keep them moving together?
I know, absolutely important, and we always say it's sort of a role modeling, right?
Mm-hmm.
So if you have somebody that you love and you trust, and that person is also ready to, for instance, quit smoking because to help you, it's huge. So I
Mm-hmm.
think supporting each other in good habits and get rid of the bad habits, it's really critical.
Definitely.
And so. And there is always this generational gap. If you say to your children, "Well, keep, quit smoking, quit using drugs," so those those kind of words doesn't resonate
Right.
as much as if among the peers there is understanding. Well, this is really not good for you. We should help each other, and this sort of social network and interaction should be critical in creating those good behaviors. So I think uh, I, going back to smoking, because that's a very important thing, and
It's very big in Kentucky too.
it's very big in Kentucky. And what I noticed, a lot of vaping is going on.
Yeah, even with the children.
Right, and of course, there is a business side of it, and manufacturers who will put all the flavors and everything to make it appealing. But I think for younger people in the audience, I mean, vaping is even worse than regular cigarettes from many aspects, because it's a
Yeah.
concentrated nicotine product. So I think we should really make more sort of awareness of
Definitely.
vaping, that this is really something that is not gonna bring us to the better brain health in
Right.
in population.
And that's because of the nicotine and its effect on the blood vessels and the cardiovascular
Correct.
system. I think a lot of people feel like it's more harmless than smoking because they're not giving that secondhand smoke to other people as much, or they're not offending them with the smell. But so what would you say to that?
Yeah, well, so I mean, if you kind of affect your own health, this will ultimately affect other people who live with you, people who love you, and in general, you will have more problem later in life. So I would say this is not a good habit. I understand also young people have a lot of stress,
Mm-hmm.
and a lot of nowadays. I know it's hard. I kind of feel it's every generation pretty much goes through some hardship, whether it's been, this younger generation, COVID, it was huge, right? Event for everybody. But then, it's from the schools, from, jobs later on, to, family situations. And if there is disease in the family. So there's a lot of stress, and growing, it's can be stressful, just
Yeah.
growing and maturing, and the younger people and even children, trying to find their way in the society, right? And try to find the way how to cope with all this stress. And then sometimes it's easier to go to those bad behavior, right, then face it. But that's why it's important to know you're not alone there.
Definitely.
And so that's why it's important, if, there are always going to be friends, family members, people that you live with in your neighborhoods, ready to help, as long as you can, open yourself. And then, of course, there's a lot of professional help, which I think, it's going to be, less and less rely upon, because, and it's access to care, and it's expensive, and, and to go to physician to quit smoking, it's not going to be your first line, because, physician will spend, a few minutes with you talking about that, and then give you prescription. But I think what you need is support group that will constantly be helping you when you get those cravings. No, please do not go back, right?
Yeah, and we can include in the show notes a link to the tobacco cessation support groups that we have in contact with here that you could join in with. I believe there's a lot of virtual support now as well for smoking cessation, as well as places like BetterHelp. Provide counseling. So if you're engaging in some of these activities, whether you're using food to make you feel better, or you're using alcohol or smoking to make you feel better, but you have underlying concerns that are causing you this stress that need to be talked through so you can move on and be healthier, places like BetterHelp or other telemedicine for counseling can be available to those who may not have access in person.
That is a critical information. And, thinking about a younger generation, they're all very technology savvy, right? They love technology. I see everybody's on their iPhones.
Well, apparently a lot of people in nursing homes are on their tablets all day too now, because it's a way they can connect. So that's something that came out of the pandemic too.
So let's work on some cool AI models that will constantly provide feedback. And whenever you kind of feel you have craving for something bad, you just tap on it, and some AI system should come back and tell you, no, let's do this.
And give ideas.
Give ideas, give something, distract you, give you something else to do, motivate you not to do it. So maybe we can develop something on those lines.
That sounds fun. They're going to make that robot nurse yet, aren't they?
No, I hope not. Because they will never replace what you can give with your care and personality, and really deeply caring about the person. So that I think that will never be replaced.
It's pretty irreplaceable, that human connection.
Yeah. That is never going to be replaced. Although, I do see a lot of advantages of AI in saving our time, but also disadvantages. But we need to mention it because it's coming. Yeah, it's already there. And it's developing exponentially, not linearly. We're kind of used through the history that we have little steps by steps in development of either technologies or medicine or drugs, right? But now it's going like this, right?
It's growing a lot faster now.
It's extremely fast. And in 5 to 10 years, we'll be in a different world. And in medicine, I hope this would create a lot of tools for us to help us, right? To streamline our, healthcare systems and processes. And then in the patient, we'll have more time to talk to the patients and families instead of constantly typing our notes and, getting the approvals and all of the prescriptions and sort of going through our electronic health records and closing the charts and looking the images. So I think it would be a lot of help, and I hope they will have more time to really spend and talk to our patients and families.
And speaking of prescriptions, one thing that we didn't even have written down to talk about, but I think would be important, especially for our young stroke population, is the combined risk of hormonal birth control
Hmm.
in increasing stroke risk. Is that something that you can speak to?
Yeah, so it is in the young female. It is the hormone anti
Estrogen?
estrogen are really the number one risk factor for stroke, and so that is you know, especially of the certain type of stroke, which is more sort of bleeding or hemorrhage, what we call, and also for ischemic stroke as well, and especially if they smoke, right?
So the combination of
Combination
smoking
smoking,
along with taking
correct,
estrogen-containing
right.
birth control can really increase the risk of
Huge,
stroke. So,
huge. So that's why we would, if you are on the birth, control, I would definitely be absolutely not to smoke or vape.
mhm.
So, I think
And
that
maybe talk to your primary care or gynecologist, whoever's prescribing, and talk about finding a solution that doesn't contain estrogen.
correct, correct. And then there is a huge also those are young women, and then there are women who are sort of premenopausal,
Mm-hmm.
menopausal, postmenopausal, and although numerous studies have shown that this extra estrogen supplementation, it's may help a little bit of the symptoms of menopause symptoms, but it definitely increases the risk of stroke and even increases the risk of cognitive decline. So we would not be advising that only on a short sort of period of time, but not prolonged sort of estrogen treatment for menopause or postmenopause. And there's
Interesting.
numerous studies that showed that.
So, hormone replacement therapy with estrogen has been associated with
Hmm.
increased cognitive decline as well
Yes,
in
that's
people who
been.
haven't had a stroke.
Yeah, that was in the women's health study that's
Oh,
been
wow.
showed very clearly.
Wow. Well, see, you're just a wealth of information. I really appreciate you taking this extra time to share with stroke survivors and their families about what they can do to support each other in preventing stroke and having a healthier brain overall. So, thank you so much for your time and for being with us today.
Thank you so much for inviting me. It's a terrific pleasure to be here.
Well, subscribe to the Stronger After Stroke podcast on your favorite platform, and I'll see you in the next episode.